So opportunities. So I like to focus on the importance of the public health approach to hearing health. So let's look at this slum. This is a slum in Nairobi. It's called Kibera. It's one of the largest slums in Africa. And it's very poor environment. There's a lack of drainage, very polluted setup. People are exposed to a lot of infectious diseases. There's overcrowding, lack of access to healthcare, and so on. How do you deal with hearing loss in a situation like this? Or how would you deal with hearing loss in a poor rural area like in Malawi? They get a visit from an ENT about once a month or less. And that's all that's the only possibility they have for ENT care. What about one of the mega cities of Asia, Mumbai, largest city in India, vast area of slums, and then many other people living in high-rise buildings? How do you deal with hearing loss in populations like that, or even in this area, the Pacific Islands? My feeling is that we need to reorientate our thinking, especially the thinking of clinicians in ENT and audiology and health planners. We need to reorientate the thinking towards the public health approach, because many people are not familiar with this, particularly clinicians and specialists. So this is just the definition of public health, but it's an art and science of preventing disease, promoting population health and extending life through organized efforts. Clinical medicine deals with one-to-one, it's the health of individuals, but public health deals with the health of populations. So otherwise they're quite similar. So you do, in clinical medicine, you have a consultation and a diagnosis and a follow-up. In public health, you make the diagnosis through a survey, the diagnosis of the health in the population. You have interventions like prevention and other interventions, and then for the follow-up, you do a second survey a few years later. And we need to focus on, in public health, on the highly and the moderately frequent causes. So these are the causes of hearing loss divided according to their frequency. Very high frequency inherited causes, chronic otitis media, aging, and then the moderate frequency causes such as excessive noise, ototoxic drugs, and other infectious causes. Those are dealt with by public health, and the low frequency causes would be dealt with by clinical medicine one-to-one because they're less frequent. In order to get there, we need to decide how or which kinds of conditions will we target, and we need to target conditions which have two characteristics. They need to have a high prevalence, which we've just said, but they also need to have an effective means of control. So when those two characteristics come together, we can then focus our efforts to intervene against those particular causes. The other criterion for selecting an intervention is to find interventions that are cost effective, because there's no likelihood of getting an intervention implemented if it's too costly. So governments are going to look for interventions that are cost effective. And WHO has recently looked into this, and they have decided that things like prevention of hearing loss through protection against loud sounds, treating otitis media, that is cost effective. Screening of newborns, school children and adults, that is cost effective. Providing rehabilitation for hearing aids is cost effective, and also even improving access to cochlear implants. Although they're very expensive at the point of access, overall, if you measure the improvement in health, then it works out that cochlear implants are cost effective. Other programs like primary ear and hearing care, providing hearing aids on a national scale, massive scale, setting up national programs, training for program planning, which is what I do, and health education and advocacy are also cost effective. Just quickly looking at this public health planning for hearing impairment, this course, these are some of the reasons to have the course. Well, I've mentioned most of these reasons. already, but these are what I use to promote why people should take this course. And we've already had the course in a number of different centres, 12 different centres, now 13, now we're coming to Auckland, and we've trained over 1,000 health workers. But even so, it's still a drop in the ocean. We're trying to change a global situation. So we need to train many more people in the public health field, and we're going to set up an online course, I hope, next year. So that will reach a lot more people than can be reached by one-to-one, face-to-face courses. And these are some of this is just to mention that we're going to new place. We're going to Indonesia next year, and we're doing this MOOC, a massive open online course, hopefully ready by next November. Couple of examples of sustainable projects. This is from Kenya. That's a lower middle income country, I would say. They have got some organisation, but it's not perfect. So they decided they needed to set up a national strategy. The problem was the lack of a national program, uncoordinated service provision, and a lack of training and infrastructure, and a lack of data. So they found that most of their specialists are in the 90% ENT surgeons in the capital, Nairobi, or in the big cities. The same applies to audiologists, completely in the urban setting, and speech and language therapists. So there's it's skewed. You need people in the rural areas, but they're not going there. They're mainly in the cities. So the usual conditions are the ones they needed to look at. They first attempt to set up a national program in 2008, and they formed a national committee, but they only had mid-level officers from the Ministry of Health, and there weren't the higher level people involved. So gradually it just died a death, and they didn't continue. But then a Minister of Health came along who did have an interest. I think perhaps he was an ENT specialist before he became Minister of Health. So there was renewed interest in setting up a national strategy. It still needed some kick-starting, and it wasn't until the WHO, the head of the WHO deafness program, actually visited Kenya that it got going, and they set up a technical working group and used some of the planning tools from WHO to develop the national plan. This is the outline of the plan, the ear and hearing care strategy, and the goal and the strategic objectives. So all these things came together to produce this national plan. So this was a positive development. Kenya has a devolved health system, so they now, having got the plan at the federal level, they need to extend it to the different counties, which determine their own resource allocations and priorities for focusing on. So they needs to be sold to the counties. So I asked Professor Macharia, who's running this project, what do you think he needed? We needed for setting this up, and he said, well, you've got to have good leadership and determination, and you've also got to have patience and endurance. And he showed that slide in a presentation he gave, which I thought was rather good. In Malawi, that's a different situation, a much poorer country, 14 million people in southern Africa, lack of education, the majority are below the poverty line, very little expenditure on health, lack of people. There's only 2 ENTs now, 1 clinical officer, they're training more, they've got 1 audiologist, they're going to hopefully get more. But so for that number of people, the resources are minute, and they need resources in every area of work in this field. So they have just now made a national plan, but it's a plan in name only because there's no actual money available to implement the plan. So that's hopefully they will get money and they'll be able to realise these targets. And there's the first group of ENT clinical officers. So those will make a big difference when they're sent out to the rural areas. And this is a van provided by Sound Seekers. It's a modified Land Rover with a sound testing cubicle on the back, so they can drive out to the rural areas and do hearing screening and provide treatment. So that's the two examples. Shall I?
Please, go on.
All right,
Yeah,
you can cut it as you wish. Yeah. Now, two other things I want to just quickly look at. The role of WHO. So I think there are two key roles in terms of what WHO does, the World Health Organization. First of all, raising awareness, and secondly, providing technical support. So in terms of raising awareness, this is a picture of the World Health Assembly. This is held every year in May in Geneva, and this is where all the ministers of health and the top-level health delegations from all countries of the world meet together and discuss the global health agenda, and also to make resolutions on different matters of critical importance in the health field. And so in 2017, they actually passed a resolution on prevention of deafness and hearing impairment. And for our field, this is a major development because now it encapsulated the key priorities that's needed in the world for all countries, because every country signed up to this resolution. It was unanimous declaration. And so, in theory, every country should be implementing this resolution. They agreed to intensify action to prevent deafness, hearing loss, and recognize that 90% live in low and middle income countries, and most hearing loss can be avoided or managed. And these were some of the issues that the resolution called on governments to do, such as collecting data, integrating ear and hearing care strategies in primary health care, establish training programs, and so on and so forth. All the other things, screening, improving technology, control of work and leisure noise, etc., better means of communication. So if the governments put their money where their mouth is, as you might say, they would be doing this. But some of them are perhaps doing it, but a lot of them have signed up, but so far haven't yet started implementing things. But at least we now have a global plan of action to deal with the issue. WHO is also raising awareness through International Ear Care Day. These are the theme. Each year has a theme. That was Make Listening Safe. 2016, Childhood Hearing Loss. 2017, Action for Hearing Loss, Make a Sound Investment. And that was the cost of hearing loss. And last year it was Hear the Future, Take Action Now. And this year the theme was Check Your Hearing. And they produced an app. So you can download an app from the web and check your own hearing. So that's quite useful. So people can do self-screening. The other activity that WHO does is provide technical support. I just want to mention Professor Ken Newell here. He was born in New Zealand. He started his medical career in Te Araroa region in New Zealand. After that, and several other posts, he became director of something called the WHO Division of Strengthening of Health Services. He was later head of community health at the Liverpool School of Tropical Medicine, and I was there. And he was actually my boss for a short time. He was a visionary person in terms of public health, and he inspired me to go into this field. But I'm mentioning him now because of the work he did at WHO, and he produced this report called Health by the People. And I think this was a revolutionary report because it took this idea that health should be decided by the people that have it. So the community itself determines what sort of health care they want to have and how it should be set up. It's not imposed upon them. And this was a revolutionary idea at the time. It still is in many ways. And this report led directly to the development of primary health care, which is one of the major achievements of the WHO since its inception. And this was at a meeting in Alma Ata in the USSR, as it then was, in 1978. They came up with the key principles of primary health care. And so that the important point about that is that it's universally accessible and to everybody, and it's through their participation. They are determining the sort of healthcare they want. So it came out of the ideas of Ken Newell. And from that, we decided to have a workshop on primary ear and hearing care in Cape Town in 1998. And we wanted to base primary ear and hearing care on primary health care. And we felt that this was needed because most developing countries do not have primary ear and hearing care workers. And even so, the topic is hardly discussed or addressed in the training of primary healthcare workers. So we produced these manuals on primary ear and hearing care, and these have been translated into all 6 UN languages. Here's the French version, but all other languages as well. And so these is spreading the ability, they're very practical manuals, how to do primary ear and hearing care around the world. These are some other documents that WHO has produced on newborn and infant hearing screening, community-based rehabilitation for ear and hearing care, this multi-country assessment I already mentioned, planning and monitoring of national strategies for ear and hearing care, practical manual, how to do a situation analysis in setting up a program, indicators for monitoring for services, the preferred profile for hearing aid technology in low and middle income countries. And this one is an initiative of the WHO Deafness Programme together with the International Telecommunications Union. This is on a project called Make Listening Safe. So this is addressing this issue of noise-induced hearing loss in young people. Currently at WHO, they are updating the primary ear and hearing training resource. They're continuing with World Hearing Day. They're updating the WHO Ear and Hearing Survey Protocol. They are also developing a new method of assessment of hearing loss called the rapid assessment of hearing loss. If this works, it will revolutionize the way we collect data. So it'll enable us to do rapid population-based surveys and so gather far more data in the world than we have done previously. The WHO Hearing Forum is being set up. This is a gathering of all stakeholders in the field. The first meeting is going to be in Geneva in December, and so this will hopefully act as a kind of momentum for pushing the whole subject forward and raising awareness. And lastly, they're going to produce the World Hearing Report. They've got the World Report on Disability, came out a few years ago, but now they're going to have a World Report on Hearing, and that'll come out next year. So lastly, the cost of not addressing hearing loss. So WHO came up with this huge figure, $750 billion. That is the unaddressed hearing loss, the cost of unaddressed hearing loss. So this is a kind of challenge and an opportunity, I think, because this is the report. It's well worth reading this report. You can download that from the WHO website about these global costs of unaddressed hearing loss. And these are some of the costs to the healthcare sector, the education sector, the loss of productivity, and the costs to society. They can put an economic cost on all of those things and came up with that total figure. So I think this is a wake-up call to governments to show what a massive cost that hearing loss causes if you don't do anything about it. But it is an opportunity that if you put money into prevention and interventions like provision of hearing aids and other cost-effective interventions in the population, then you can reduce this massive cost of unaddressed hearing loss. So, in fact, it is a good investment for governments to make. So these were the conclusions of that report. Just more or less says what I've just said, so I won't go through them now. You can read them. But they say that public health interventions for prevention and early identification are cost effective, as are the provision of hearing aids. And they recommend hearing loss must be addressed as a public health issue. There is a need for policymakers to allocate resources to promote access to ear and hearing care. Public health strategies should address prevention, screening, and early intervention, and country-specific data on the cost of unaddressed hearing loss and cost-effectiveness interventions should be gathered to strengthen available evidence. So that's the covering of the challenges and opportunities. You might wonder, well, you say all this is happening maybe at the global level, a lot of things at the global level. What can we do? Well, somebody asked this of a former WHO Director General, and he had a very pithy phrase. He said, think globally, but act locally. So I think that's the watchword of what we can do. We mean to think globally, but transmit or translate that knowledge into acting locally. So that's all. Thanks for listening.